Well, if I'm not correct, Werner is the NGO Fields Agree. Yes, sorry. Keith is going to talk about the medicinal aspects of marijuana. Is that right? Medicinal, Fields Agree, and then our final speaker is Jeremy Acton, A-C-T-O-N, founder of the Duffer Party. Jeremy has a farming background and founded the Duffer Party in 2009. Contested one municipal election so far, but now is nationally registered. And he is going to talk about the legal issues surrounding Duffer at the moment. So, without any further ado, Keith Scott.
Hello everybody, can you hear me? Yep. Okay at the back? My name is Keith Scott, as the introduction said. I'm a medical doctor, basically a GP, and I've got an interest mainly in legalizing cannabis. That's my main, the reason I got involved. And but I was involved to a certain extent with the medical innovation bill with Dr. Mario Oriani Ambrosini. So I got involved with that. I've never treated anyone using cannabis or any of the cannabis products, but I've done a lot of reading about the subject, and the whole sort of medical aspect of cannabis ties in with the legal side. So what I'm going to do is try and read my notes here as I go along. And talk about the medical side. I'm not talking about the legal side. That'll be done by, I think, Jeremy and Werner. So, first of all, the definition. The definition of medical cannabis refers to the use of cannabis and its constituent compounds such as tetrahydrocannabinol and cannabidiol as medical therapy to treat disease and alleviate symptoms. Okay, so that's basically the definition out of the way. But then we have to ask, is cannabis an effective medicinal plant? Is it really? I mean, we've got a lot of historical data, thousands of years of use in traditional medicine, but that's not good enough in modern medicine. We have to prove that it works. And in more recent times, say 100 years ago, before it was banned in most countries, it was used by doctors, in the 19th, 20th century, quite legally. And in fact, in Victorian times, Queen Victoria was treated regularly by her doctor for menstrual cramps, labour pains, and various other ailments. And some people actually, especially the stoners, believe that that's why she lived so long. She lived to over 80 years old in those days, which is quite a long time. And in fact, they probably point out that her granddaughter, Elizabeth, is going to probably live for longer than she did. So that's proof in itself. But if there are any Brits here, they'll probably maintain that the reason Queen Victoria and Queen Elizabeth are lived so long is because all their loyal subjects sing God Save the Queen regularly. So there you have it, you've got stoners versus loyal subjects. And so we've got to look at the scientific side of things to make sure that we get it right. Now, although many people, and I've seen blogs on various websites, claim that there's definite evidence that cannabis works for X, Y, Z disease, the facts are actually otherwise. And the reason is because scientific criteria, a rigorous scientific debate requires certain criteria if you're going to register something for a specific use. It doesn't mean to say that cannabis is not effective for those diseases. It just means that it hasn't been proven to the satisfaction of scientists. And that's because, obviously, these draconian restrictions on cannabis in most countries, it's been very difficult to do research into its medicinal benefits. However, most of the scientific stuff that you'll see is basically in vitro, that's in the laboratory, animal studies, and very few human studies. And these studies show that it is effective in that situation, in the laboratory, for a wide range of diseases. But to get registered for a certain disease or symptom, to be officially registered, any medical, any medicine, any herb has to go through phase 1, 2, and 3 human clinical trials. And that is a long process, it's an expensive process, and obviously if you've got restrictions like non-availability of the product, then it's virtually impossible. So all the studies you see are very early studies about how the cannabis works against cancer cells in the laboratory, etc., etc. So there's very little evidence to show that cannabis actually does work against certain diseases. And that's why if you watch TV or you hear other doctors talking, they will say there's virtually no evidence that cannabis is an effective medicinal plant. Okay, so that's why you're going to get those answers. And I think you need to understand that to see why the medical profession says that. Because if someone comes to me and asks me, do you think it works? That's the answer I have to give. Even though in my practice, not that I've done it, but in my practice I've seen people getting better taking cannabis in various forms. There's no scientific evidence that it does actually work conclusively. But it does have potential. That's the thing. It has huge potential because of all those early trials that show that it works in the laboratory. Having said that, there are some products that are registered in certain countries that are cannabis products for certain conditions. Now the first one is, or the one is Marinol, which is mainly available in the States, also known as dronabinol. And this is a synthetic form of tetrahydrocannabinol, which is THC, which is the compound in cannabis that makes people high. Okay, so they've taken that and they've manufactured it in the lab, and it's a synthetic form of THC. And it's only registered for people with HIV, especially for the anorexia, the lack of appetite in HIV, and for nausea and vomiting in people undergoing chemo. And those are commonly known uses for cannabis, and now they've taken the THC. So it's the THC, that one compound, that has those effects. And that's in fact what they do in medicine now. They take compounds out of plant products or sea urchins or whatever they're testing. They try and find out the active ingredient. And the trouble with cannabis is that it has about over 70 different cannabinoids. These are unique compounds unique to cannabis, and there are only a couple that have been tested to show that they're active. And if you take one compound out, you might lose the benefit of the others. The two that are used mainly, that are tested, is THC and CBD, cannabidiol. And I'll mention that a bit later. Okay, so the other product that's registered, mainly in the UK and I think Canada, maybe somewhere else, is called Sativex. And that is actually a tincture of the plant. So they take the plant and they make a tincture, and it's a standardized extract. That means they know exactly how much THC, CBD is in that product. It's standardized, and that's something that will come up in other aspects of legalizing cannabis. Because and for medical people using cannabis, if I'm a doctor and I'm asked to prescribe a medicine, I want to know the strength of that. If I know that I want that person to have more THC because they need appetite stimulation, or if they need more CBD in the plant, which maybe the child's got epilepsy or something like that, which it's shown to be have a lot of potential for. If it's not standardized, I don't know what they're getting. I mean, there are all sorts of cultivars of cannabis now. And, you know, they're breeding them to have higher levels of THC. If you want CBD, you're not going to get it. So standardized extracts are very important so that we know exactly what's in that plant. You can't just go and take a plant and think, okay, this is going to cure my kid's epilepsy, because it might not have any CBD in it. And you might, on the other hand, you might have a lot of CBD and no THC. That's what they're breeding plants in the States now, where they've got very high levels of CBD, and it doesn't even give you a high. It hasn't got THC in it, but it seems to be very good for epilepsy. All right, so these are the sort of biochemical aspects which are important. So there you've got Sativex. They're doing some more studies on Sativex for treating cancer pain. So you can see that's a pretty narrow scope. People who know and have read a lot about cannabis, maybe they treat it themselves. There's far more to it than just nausea, vomiting, anorexia as a treatment. So they're just scratching the surface there. All right, so let's let's have a look at the clinical evidence. I must just keep an eye on the time. I don't want to ramble on. The scientific evidence so far that I mentioned, that they've done in the laboratory and maybe a few animal studies, just what the potential is. Now, the reason that cannabis, one of the reasons why cannabis is has such potential is because it has these cannabinoids actually influence certain receptors in the body. Now, if you want a chemical to work on a particular cell or cell group, normally what the scientists do, they manufacture a chemical that will activate a receptor. Cells have got a lot of receptors, and the body's got its own chemical messengers, which either switch on those receptors or they turn it off. For instance, insulin for diabetes, that has a receptor on all cells, and if those receptors are not responding like they do in certain types of diabetes, even if you've got lots of insulin, maturity onset, people who get overweight, etc., those receptors stop responding. Okay, so the insulin, you can give that person as much insulin as they want, and it's not going to work very well. Okay, so that's what a receptor does. It's like a lock, and the chemical that opens it is a key. Now, they're finding more and more of these systems in the body. The one that they found about 40, 50 years ago was to do with the endorphin system, and that is to do with pain, etc. And the reason that morphine and heroin and those opiate drugs work is because they actually switch off or switch on the opioid receptors. They have a similar chemical compound to the body's own chemicals that switch those ones on and off. And it's the same with cannabis. These cannabinoids actually work on the cells because the cells, certain cells, especially the nerve cells, are part of what's called the endocannabinoid system. And your body has its own endocannabinoids, which are like these products, these compounds found in cannabis. Okay, so there's a similarity between them, and that's why cannabis makes people high, the THC, because the THC activates certain receptors in the brain, as does anandamide, which is actually a cannabinoid your body produces. All right, so if you understand how these chemicals work, then you get a good grasp of the research that's going into cannabis. Right, so there's the endocannabinoid system, and then we have these cannabinoids. As I said, cannabis has got over 70, and only a few of them have actually been tested, but the other ones are probably also active in a certain way. But the main ones at the moment are THC, tetrahydrocannabinol, and CBD, cannabidiol. Right, so cancer, there are a lot of, relatively, it's actually quite a few, but relative to the amount of chance people have had to actually do trials with cannabis, there are quite a few. And where these compounds are found to help with breast cancer, prostate cancer, lung cancer, colon cancer, brain cancer. And what they do, one of the methods, one of the ways the cannabinoids in cannabis work, it's quite interesting because the CB1 receptor, they're called cannabinoid receptors 1, 2 with all the numbers. Now with breast cancer, especially in prostate cancer, you get very aggressive types of cancer. And these cancers, what happens is when the CB1 receptor on that particular, say, breast cell or prostate cell is turned on, it actually accelerates the cancer. So when that receptor is switched on, it makes the cancer worse. What they found is the THC actually switches off that receptor. And actually, that's one of the ways it works, by inhibiting prostate cancer and breast cancer. So it's quite interesting. That's why the receptors are so important, or one of the important things about it. So breast cancer and quite a few other cancers. I'm not going to go into the detail. It's just that it's interesting to know that why cannabis has such huge potential in treating cancers and preventing cancers. Because we know there's one mechanism where it will switch off those receptors. The other thing is that most cancers are associated with inflammation in those tissues, in the cells, or the whole body. Inflammation, often oxidative stress, which I won't go into. cannabis compounds, cannabinoids, they actually reduce inflammation in the body, and they reduce, counteract oxidation. So that's another. There are two basic methods: the receptors, antioxidants, and anti-inflammatory factors. Okay, now I'll just go through a couple of other diseases that is attracting a lot of interest among scientists. There are a lot of scientists, especially in America, but I think there are a few here, that are really keen to do this research because the anecdotal evidence is so strong that they want to get moving on it. But we've still got all these legal issues to get through. Okay, so Alzheimer's, then again, we're talking about CB1 and CB2 receptors are known to be involved in the regulation of calcium. So there again, the cannabinoids from cannabis can actually change that, maybe perhaps help Alzheimer's. The other thing is, we know a lot of people take it for joint pain, other neurological diseases like Parkinson's, multiple sclerosis. And then the other conditions like Crohn's disease. And interestingly, they're finding it's actually limiting the effects of alcohol on the liver. So it actually protects your liver against alcohol, which of course, as we all know, is a far, far more dangerous drug than cannabis, which is actually not dangerous. But there we go. So those are some of the conditions. Now, to get into the adverse effects, every single substance on this earth can be bad for you. It all depends on the dose. Okay, and I think that's another important thing. A lot of people say that cannabis is not dangerous. Cannabis is dangerous. Water is dangerous. Water kills people. They drink too much on a marathon, they will die of overhydration, cerebral edema, and this has happened often. Okay, they don't have to literally drown in it. Oxygen is a highly toxic compound, but we can't survive without it. So anything you take for too long or too much in one go is actually bad for you. So cannabis is no exception. It's dangerous, but can it kill you? Well, in fact it can, and it still kills people, believe it or not. I know there are a lot of stoners around here who will shake their heads and say, what's this guy talking about? Well, it can. I'll tell you why. Because cannabis, the compounds that make you high come from mainly the resin, but the other parts of the plants, including the stem. And cannabis, the stem of the cannabis plant, years ago, and to a certain extent today, was used for making hemp, which is a rope. Okay. And what people used the hemp for was for making nooses, hangman's nooses. Okay, so there you are. That's the only time that cannabis ever kills anyone. There's been no other recorded incident.
Also the bell and it falls on you.
Yeah. Bales, yeah. Okay, so look, the people will trot out other things, but there's nothing been proven apart from that. Okay, now I just want to go over a few of the toxic effects. There are not very many toxic effects. Obviously, if people get very high, they can have hallucinations, dissociations, all those things that you can get with a psychotropic drug. But in terms of diseases long term, and in fact, directly, there are very few side effects. Cannabis, if you smoke it, if you're high, you can still have an accident because your judgment is out. It's not nearly as bad as alcohol, and as we know, it doesn't make people violent. But the direct effects are few and far between. There's a lot of debate now, and the people who are against cannabis, they bring up the latest one, which is going on a lot, is that it causes schizophrenia. Now, there's no evidence for that at all. There is a little bit of possible evidence that people who start using a lot when they're young, it possibly can. Okay, the reason people say it causes schizophrenia, because schizophrenics have a higher, smoke cannabis more than people who are not schizophrenic. Right. But that's an association. It is not scientific. It's not a cause and effect situation. I haven't proven it.
Some people say that's even self-medicating.
Well, yeah, that's the whole thing. Yeah, self-medication. The other thing is that people with schizophrenia take more substances than non-schizophrenics. So because they're self-medicating, because they don't like their medicine. So that, I must qualify, I don't think that children should take cannabis. I don't think they should drink alcohol. I don't think they should take any psychotropic drugs. Most of them are on Ritalin anyway, which is not a good thing. But, so the schizophrenic issue, and in fact, as I mentioned earlier, there's some evidence that cannabis can help schizophrenics in certain situations. I mean, they're obviously using other drugs now. They're using MDMA, they're experimenting with that. They're using psilocybin to treat psychosis. And cannabis is one of those. So the schizophrenia is not an issue so far, but it might be so with kids. All right, now, there's a recent study that showed that it might be associated with stroke, increasing the risk. But of course, the problem is with most people who smoke cannabis, smoke tobacco as well. So they haven't proven that. It's just a new one. I just mention it because it's out there. But it hasn't been proven yet. But you've got to realize that if you smoke cannabis, cannabis is also, like cigarette smoke, it's got all these tars and all that sort of thing. Smoking cannabis is not the best way to take it. If you want it medicinally, you can take it in other ways. And the other thing it has is that it's got carbon monoxide. And carbon monoxide, what it does, it attaches to your hemoglobin molecule and it displaces oxygen. So your body has to produce more red blood cells to compensate. This is a standard thing in a smoker. If I take a blood test from a smoker, I can usually tell that they're a smoker because their red blood cell, their hematocrit is quite high. And then your blood's a bit thicker and you're at more risk for stroke, heart attack, etc. All right, the other ways, obviously, of using cannabis, which are a lot less harmful than smoking. There's no evidence that cannabis itself causes lung cancer, the smoking of cannabis, even though it's got the tars and everything. Because there again, most people who smoke cannabis long term have smoked cigarettes for a long time, so they can't really divide these two groups up very easily. But there's evidence that the cannabinoids actually protect you against cancer. So that might produce, though the other products in the plant are aggravating, damaging your lungs, the cannabinoids are protecting. But the thing about, where was I now? It does cause lung inflammation, definitely. So you shouldn't really use it if you don't have to. So, the best thing is to use other means. The vaporizers are the best form because they just vaporize the active ingredients. You don't get all the burnt plant material. And the other, the bongs aren't that great because what they do is they trap the smoke in water, and the water actually takes out a lot of THC. It traps THC as well. So what people use bongs, they have to smoke more cannabis, so they're getting more of the other impurities they don't want to. So those aren't that great. All right, now, getting back to I mentioned the standardization. All right. Now, the thing is, as doctors, we're in a quandary about when somebody asks us, as I mentioned earlier, is cannabis good for certain diseases? We don't know, because as a doctor, I can't say to anybody, I can't go up in public and say, it works, because we haven't got the scientific evidence to say it works. I could say to them, well, I've used it in my practice for X condition, Y condition, and it's helped. That's anecdotal. That doesn't mean I can get up and say, let's do it. Now, the health department has been asking, I think the MRC, I got the paper before it was published, I think it was Medical Research Council in Cape Town. They did a paper on medicinal cannabis because, of course, the whole Mario Ambrosini issue, the Medical Innovation Bill, got everyone talking. So they quickly rushed, got the MRC to do a paper, and the paper just did what every other doctor is going to do in terms from a scientific perspective. They just said there's not enough information, just like I've told you now. So there's no point even going that route. If you go that route and say we want more studies done, which is what they recommended. The MRC said, let's do more studies to see if it works. Okay, but you won't get more studies because it's banned. And so it's a cycle, and it's a waste of time. That's why I'm more focusing on the legal side than the medicinal. I'm against the Medical Innovation Bill. I spent quite a bit of time with Mario Ambrosini and the people with him, And certainly in its present form, I'm completely anti it, because what it does, the Medical Innovation Bill in its present form, I know it's going through various committees now, so it might have changed a bit. And he said it's the thin end of the wedge. He started it like that. He said the end aim, if he was alive, would be to legalize. But the problem with it, it states that they want certain centers of excellence in teaching hospitals where people with cancer particularly will be treated with it, but no one else will get the benefits. And then they'll do the studies, which could take 15 years. In the meantime, people are still getting locked up, having their crops sprayed, all that nonsense going on. So that's why a couple of my colleagues and I, we disagree. The other reason is if they take a step further and they say, okay, we're going to legalize medicinal cannabis like they did originally in Colorado and other states, then what happens is people can take it for medical reasons, so the doctors can prescribe it. But as I said before, a lot of doctors won't do it because they don't know what the standardization in that thing is. If you come to me as a doctor and I prescribe you some morphine, and I say, oh yeah, take 30 milligrams and you drop dead, I'm going to jail. You know what I mean? Not that cannabis is going to do that, but I know that I can give X amount of morphine. If I give it out of the bottle, I know exactly what's in there. And that is a very dangerous substance. You can overdose very easily. But the same goes for other things. So the doctors will say, no, why just because I'm a doctor do I have to prescribe it? You give me guidelines. You say to me, I will tell that person to smoke so many joints if they've got MS or whatever. But you, the health department, must tell me what I can do. Otherwise, the responsibility is on me. If something happens to that patient, in fact, I've been trying to get an answer out of the Medical Protection Society, who give us, who insure us against malpractice, to see what their view is, because they might come out and they say we're not going to insure any doctors who prescribe cannabis to their patients for the reasons that I've mentioned, because they might do harm and there are no standardizations. All right, the other thing it'll do, even if the doctors do it, is it turns doctors and patients into fraudsters, because you get all the people who just want to take it recreationally, and they come to the doctor and they say, I've got back pain and nothing else works. Sure, have some cannabis. So immediately, it's wink wink, and I'm going to give you a prescription. But I know that that person's just taking it recreationally. Not that I give a damn. I think everybody should be able to use it recreationally, all adults that is. But the point is that I become a fraudster, and I don't want to be, and I don't want the patients to be. So that's a sort of political issue from a medical perspective. So it's important to understand that, because it's not as simple as saying, oh, doctors can prescribe it, therefore it's all systems go. Because I'd be quite happy to prescribe it for people to take recreationally. I haven't got a problem with that. And, I could probably see 2 patients every 5 minutes or whatever, one patient. I'd make a hell of a lot of money just dishing out prescription. I'd love that. It's good bucks. But, it's not the right thing to do. Okay. So the Medical Innovation Bill, it's going to be for the chosen few. Those are probably end stage people with cancer where nothing else has worked. And what happens in that situation? They're probably beyond help anyway. And then they're going to do all these trials for 15 years and they say, no, it doesn't work. Because what you do is ethically, you cannot deny them drugs that work. You can't deny them chemotherapy and radiation. Doctors won't do that. The professors won't do that. And then they give them cannabis at the end. And unless they're very fortunate or whatever, they're not going to make it. So then at the end of the trial, they say it doesn't work because they're only testing it out in terminal patients. They might have a few where there's no chemo or no radiotherapy for that particular cancer. But they can say, nothing else works. Let's give them cannabis and see if it works. All right. The other drawback with the Medical Innovation Bill that I'm really worried about is the politicians. Because what they'll do, especially under its present form, they all got up and patted Mario on the back and had hugs and made up and stuff. And what happens is they'll push it through Parliament, and then they'll have these select few centres, teaching hospitals, and they'll sit back and they say, right, we've approved medical marijuana, and they won't do anything for another 20 years. Okay, so that'll happen, I can assure you, if the bill gets passed in anything like its present form, it'll be a total cop-out for the politicians. Right, so that's basically, we've got some time for questions, I hope. I didn't want to get too heavy with it, but the important thing is to know how cannabis works, why it's got potential, why it can't be registered, why doctors are against it, and then obviously the political stuff. So thanks very much, and thanks for all coming. Any questions, comments? Anyone against what I've said? Because it's a debate, you know.
I don't think we'd be here if we were against it.
Sorry?
I said I don't think we would be here if we were against it.
Yes, well, the comment was that we wouldn't be here if we were against it. But, you know, some groups, people come along and they are against it, and they've got valid points. Sometimes they haven't. But, yeah.
Do you have a formative plan ahead due to these?
Sorry?
Do you have a formative plan to deal with these issues regarding
Myself? Yeah, I've got a couple of colleagues, and we've been approaching politicians. We've been doing it. You know, there's a lot of good work being done by Jeremy and you know, the Ducker couple and everyone involved there, publicity, because, you know, in the end, and I think that's the important work. My view is that the court cases, my view is that I don't think the politicians will come to the party, and I think the court case, and hopefully they'll win it with the Ducker couple. I think that's going to change things. I don't think the politicians will move quickly. But having said that, a colleague and I, Professor J.P. Fanica, you might have read his article in the South African Medical Journal a few years ago. It was quite groundbreaking, because both of us believe that all drugs should be legalized, should be legal regulation. We've come to that conclusion. And he was managing editor of the South African Medical Journal. At the moment he's consulting, he's getting on in years. And he wrote this article, and anyway, we've sort of been visiting politicians and just, you know, trying to give our perspective as doctors, because we wanted to be considered a health issue, public health issue, not a criminal like a lot of people. It's sort of an argument that's quite active overseas, and so we're doing it sort of on the softly approach through the politicians, and we're letting the other people get the publicity together. So that's in essence what we're doing. The Central Drug Authority, in fact, have got a seminar, or whatever one would call it, this coming Thursday and Friday, and we're both presenting different papers. So that's encouraging. I mean, he's not that encouraged, because he said it's just government and we're going to go along there. And they've got all aspects of the whole. It's all about cannabis, the cannabis debate and legalization. They've got a whole lot of different categories. But neither of us are talking about the medical stuff of cannabis. They've got one category about medical, and neither of us are talking about it, because we both agree, we're both talking about the legal side. And because we both agree, you've got to sort the legal stuff out before you can sort anything else out. Because anything else, I mean, we just know from the States, medical marijuana eventually became